Okay, we're good.
Okay, well, thank you very much for technology help, and I'm calling our gathering to order. We have almost everyone here, and one more will be coming in shortly. So thank you very much for being here. We are, working on a fast track here. So we want to be sure that we're using the funds, using them appropriately, of course, and always related to COVID-19. So this is a really exciting time and opportunity for us. So thank you for being here. I think maybe you want to call the roll, but for Brittany, if you wouldn't mind, please, stating the case for
Yes, ma'am.
public knowledge and transparency.
Happy to do so. This is a public meeting and it is being recorded. To quickly meet community needs, applications for funding will be considered on a rolling basis until the funds are exhausted. The organizations whose applications are being reviewed today may be asked to participate in the meeting by providing comments when asked questions directly from the Pinellas Cares Nonprofit Partnership Fund Grant Committee. If attending the Zoom meeting by computer or other smart device, you will be unmuted to respond back to the given question from the Grants Committee in the Zoom application. You will have 3 minutes to respond to each question. If attending the Zoom meeting by phone, you will be unmuted when it is your turn and you will need to press *6 on your phone to unmute yourself. If you are representing an organization whose application will be reviewed today, please enter your name and your organization in the chat function of the Zoom so we can recognize you if you are asked any questions from the committee. At the conclusion of your comments, you will be muted again. Please note that all committee members and staff participating in this meeting have signed a conflict of interest form. For those of you viewing this via YouTube or recording and you would like to provide feedback on the grant process, you can submit your comments and concerns to caresfeedback@pinellascf.org, and we will respond to those comments as soon as possible. This feedback will not be answered live. And I think that is all I have. So I'm back to you, Sally.
Okay, thank you, Brittany. And staff, let's bring up that first grant request, which is the Lawrence Dembit IV Mental Health First Aid Training Initiative.
Madam Chair, while we're doing that search, I want to be for the record that my role today is listener, and that if you're viewing by YouTube, I will not be voting on any of the requests.
Okay, thank you, Carl.
Thank you so much, Sally. So I will just jump into our agenda for the day. We'll start talking about our funding status a little bit.
Yes, thank you. I'm sorry I failed to do that. I apologize.
No worries, no worries. Just ready to jump into those exciting applications. We got some good ones ahead of us today. We'll talk a little bit about past funding requests, and I'll give you an update about where we are with those. And then we'll go into a conversation about our current applications and we'll review those. We'll talk a little bit more about next steps, and Duggan has a few things to share with you. And then after that, we will adjourn. So with that, could we have the next slide, please? So our funding status and where we are. To date, we have approved 9.9 million. So that's exciting. Keep in mind that that is approved. That does not mean that we have distributed these funds in the community. That is what the committees, both Committee A and Committee B, have approved thus far. On the right-hand side, you can also see a nice pie chart that has been created for you, just to give you an idea by program area, by strategic priority, how much we have earmarked and spent within those 3 areas. Once again, that is how much that has been approved, not how much has actually been expended to date. And then our remaining amount is almost 20 million, $19.7 million is what we have remaining to spend prior to December 30th. Any questions about that prior to me moving on to the next slide?
So of that $9,905,811.50, how much is under contract?
I can get that real quick.
Okay, well, just kind of an estimate, half of it, 2/3 of it? most of it?
I would think it's almost 2 million. Keep in mind, if you go to our accountability page, you will see what contracts are up. Thank you, Sally, for bringing up that point.
I did.
Because
Uh-huh.
once contracts, once you all approve applications, it takes about 2 weeks before contracts are actually executed. There are a few additional steps that we do have to go through. So this is just simply what the committees have approved. Give us about 2 weeks, and they actually go to contract. And we have different ways that contracts and that funds are being given. And Duggan will talk a little bit more about that and when we talk about next steps.
Okay, thank you.
You're welcome. Next slide, please. So a little bit more about past request. Week 1, I always review this. We had 4 applications that were approved, $359,000. Week 2, 5 applications that were approved, about 1.3 million. Week 3, we had 9 applications that were approved, 7.2 million. And last week we approved 5 applications, almost $1 million. Okay, any questions about that? Duggan, we can't hear you. I can see your mouth moving, but we can't hear you. If you could maybe unmute yourself, or David, if you could please unmute Duggan. There we go. We can't hear you, Duggan. Give Duggan just a moment and he will adjust his sound. He has something to add.
There.
Well, Duggan, that's perfect. Thank you.
Great. Just if we can go back one slide, and I'll to answer Sally's question quickly. What's under contract? Week 1 is done and week 2 is done and under contract. Week 3, the final review came in last night from Pinellas County. So within the next day, all that money should be under contract. And week 4, probably within a few days, I think the county will have completed its review of that. And we'll have that under contract as well.
Okay, great. That's wonderful. That's good news. Good specifics. Thank you.
You're welcome.
So week 4 and where we are, we have 4 requests ahead of us today that we're going to be reviewing. The total amount requested between all 4 projects is $1.582 million. So with that, Sally, I'll turn it back over to you if there are no additional questions regarding updates.
Okay, so the first one we're looking at is Harbor Dish, Inc. Harbor Dish is in Safety Harbor, and they've got a story to tell. So I see the average score is 87. We've had a variety of scores, some that were a little lower, some that were a little higher. So anything that the committee would like to make comments on?
I'll just say quickly that I know there was another contract that was specifically for Safety Harbor area. And I know the committee is keeping an eye on that, but just to put it out there to assure that if these 2 organizations aren't working together, that they're aware of the other services so there's no duplication.
Good point. Thank you. We wouldn't know
you,
that, Sarah. Thank you. I was one of those that commented on, I thought they really were doing some innovative things. I love doing things at the Sheriff's Youth Ranch and so on. It is a small organization, and it sounds like their resources are somewhat limited. So I'm hoping that they can deliver on what they say they can do. Any other comments? Are there any questions we probably have somebody on call for Harbor Dish. Are there any questions of the organization? Shall we ask about your question, Sarah, whether they're aware of another organization and are they working with them?
I don't know if that needs to be discussion for the committee. I think that Cherie and the foundation team could probably handle that better behind the scenes. You foundation, feel free to step in if you think whatever you prefer is best.
Sure. So I mean, I think that we're happy to make folks aware. as much as we can remember, because keep in mind, we're juggling at any one time several different applications,
Mhm.
but absolutely happy to make, a connection if there's not one already there. So I would invite the representative from Harbor Dish, who I know is on the line, to reach out to me, and I'm, happy to share back, or they can take a look at our accountability page, because we do list all the organizations, what they're doing, and what's happening. So we encourage them as much as possible to reach out to your neighbors and to see how you can support each other. Thank you, Sarah, again, for bringing that up. With something we're always cognizant of is, overlapping of services, and really want to understand how folks are working together to not duplicate efforts. Does not mean that there might not be a need that both of you all can support in the community, but we also always have to be aware of overlapping of services. So thank you, Sarah, for bringing that up.
Do we have someone on the phone? David?
We do. So we want to ask that?
Yeah.
Okay.
I think it's worthwhile to ask.
So we have Chris
don't-
and Michelle.
We need
Yeah,
we don't need to go into the details, just more, are they aware of other organization, or at least one other organization that is providing food services in the greater Safety Harbor area?
So Michelle and Chris, you can unmute yourselves.
I think I did that. Can you hear me?
Yes.
Yes.
Thank you for all that you do. To start off with, yes, we are aware of many organizations in our area that we collaborate with. Some of the ways that we do that, the Harbor Dish is a cooking organization as well as food rescue. So we would take large quantities from other collaborating nonprofits in the area, and we would turn that into healthy foods for our seniors. So we are working together as a community here in Safety Harbor to make sure everyone's needs are met. We are trying not to work hard, we're trying to work smart so that everyone is served equally and with respect and dignity.
Okay. So that does mean that you are coordinating with other organizations. That's really the bottom line.
We collaborate since we became in existence 9 years ago. Collaboration was always one of our key factors to making a difference in the community.
Okay, good news. All right, thank you very much. Any questions of any of the other committee members? If
Not to me.
Okay, if not.
Thank you again for everything that you're doing for Pinellas County.
Thank
And
you.
thank you for your service and commitment to Pinellas County.
Thank you, Sherry.
Yeah, I echo that. Thank you. If we're ready, I'd move for a motion to approve.
Okay, Sarah moved it. Is there a second?
Second.
Okay, so Bill was the seconder that I saw first. Is there discussion? Any further questions? All in favor of the motion, say aye or raise your hand, please. Thank you. If there's anyone opposed, let us know. All right. Thank you very much. And appreciate your being on the phone call with us. All right. So moving along to RCS, Religious Community Services, Inc. And they have kind of a new mission, which is interesting too, that I just arrived in my email this morning. But let's go on with questions that we might have, comments. Do we have someone on the phone with us, David?
We have Melinda. I'll unmute her as soon as there's questions
Okay,
posed.
good. Okay, perfect. Okay, questions?
I do have a question. I'd like to understand more about the JWB corrective action.
I would echo that, Ayako. So let's hear from the person from.
So I'm unmuting Melinda Perry. I
Uh-huh.
believe she's their COO.
Okay.
Hi, can you hear me?
Yes, thank you, Melinda.
Hi,
Did
this
you
is
hear the
Melissa.
question?
Yes, ma'am.
Okay.
And I'm Melinda Perry, Chief Operating Officer with RCS. So again, thank you for this opportunity. With JWB, there is a corrective action that's still in place, and it is really surrounding, I think it's one last function of our finance department, and that is updating our financial policies. We're in the process of doing that now and just waiting on board approval for that. So that should be coming in the next month or so. And that's the last item on their list.
Okay. So it was, and just for clarification, so it was kind of a long list of items, but the last one is the policy issue?
Correct.
Okay.
Is there a way, you know, I'd like to hear some of the other things that was on that list. I don't have to have the list, but just give me some of the other things that may have been on that list.
Sure. Let's see if I can pull that up. We had initially some administrative issues with personnel files. So maybe paperwork wasn't in the appropriate location. Maybe a document wasn't signed and dated correctly. Things along those lines. Same things with some volunteer files. And then we had, let's see. Sorry, I'm just trying to pull this up here. Ensuring that background checks were done timely, and that actually was not an issue. It was just a matter of having the paperwork within the file. They have since corrected all of those issues and released us from that part of it. We've had some turnover with staff in key positions, some of those due to retirement, some of those due to moving on to another opportunity. So things out of our control, but we've implemented some staff retention policies, maintaining compliance with another one of our funders, Florida Coalition Against Domestic Violence. We've since corrected all of those issues and had a satisfactory monitoring from the coalition. They were not understanding some of our background or our backup supplementation for our invoices for them. So we supplied all of the complete backup for them. That's no longer an issue. Our last audit was late due to COVID, and so we had to get extension. So that was listed on there until they received the actual audit. And then the financial policies.
Okay, thank you.
So when was that? When was the JWB concerns or corrective action request? When did it go out? When did you get that? A year ago? 6 months ago?
It was initially provided in August of 2019.
Okay. So more than a year ago. Okay. Ayako, are your questions answered related to that? Or do you have anything more you want to know?
Yeah, you asked that other question. I wanted to know how long this has been going on. How long have you been working on the corrective action? You know, so, and you answered that question. It's been about a year.
Right.
And some of the release from the items was delayed due to COVID. They weren't coming out for additional audits. You know, so they just a couple months ago, or maybe last month, did the fiscal audit to release us from the complete backup from.
Okay. I did have another question, and maybe I misunderstood what was written there, and the committee could help me as well. It did appear that the emergency food and the retail food was going down.
In terms of cost, Ayako, is that what you're asking?
In terms of number.
Uh-huh.
It looked like in the proposal, it talked about the emergency food had gone down. I wish I could pull it up. If nobody else remembers it, then I was reading too hard. Probably one of those late night reads.
I'm often guilty of reading too hard too, so don't feel bad.
Okay. All right.
Madam Chair, Religious Community Services have traditionally been a very strong organization in their spaces. They have quite a good reputation, as I understand, in the community. Not that I would in any way influence the decision here on this part, but I do want to weigh in here in terms of qualifying the corrective action status from JWB, because those things are often related to those pieces that are part of the administration and necessarily in service delivery. So I'm just putting that out there for some consideration if you decide on the vote. That's just my list.
Okay.
So, Ayakio, was your question addressed regarding the change in numbers specifically around the emergency food distribution?
Yes.
I did not hear that answered.
Well, I didn't know if I had overread, and was it one of those late night reads?
Sure. So if we could go to the representative from the organization to answer that question, because I actually do have a follow-up question related to that.
Did you find where they had said that in the proposal, Cherie?
Yes, I will leave that to the staff to ask. Can you just clarify the information that you provided around the emergency food piece?
Yeah.
Help us better understand your numbers.
Yeah.
We have a retail route that we do 3 times a week where we go to different grocery stores that we're in partnership with to receive mostly the fresh produce, the meats, the dairy, all of those types of things. And that initially when COVID came, the receipt from grocery stores was down about 80% because obviously that's when they were running out to get food. Supply got tied up with COVID and everything. So our receipt of those, the pounds of food that we would normally receive was down about 80%.
Okay.
In addition to the emergency food where, those would be done through food drives or, donation barrels placed at locations, that was significantly down as well, just because people weren't necessarily donating food at that time.
Okay.
So just a follow-up question, please. Through your work in the spring through the Tampa Bay Resiliency Fund, RCS did receive a funding for a refrigerated truck. Can you please provide a status update of where you are with purchasing that truck? We know that you've received the funds for that. When I think about emergency food, that's a natural question that comes up. So can you help us understand where that request is and how you've made progress on that request?
Sure. We were super grateful to be able to receive funds for that. We were able to get it fully funded, and because there were some specific requirements that we needed for the truck, a special lift gate, different types of things for our use. The truck is being built, and we're told by the manufacturer that it should be done just before Christmas.
Thank you.
Someone named Melvin Thomas is asking to be unmuted.
Yes, he's unmuted.
Okay.
But I didn't know if there was a question that he needed to answer.
Is Melvin, what is your role, Melvin?
I'm the VP and Executive Director for the RCS Food Bank and Food Distribution and Basic Needs.
Okay.
Just want to be available to support Melinda.
Okay. So I have a question, and that is, and it's in my notes, which is the delivery of the food to the college, St. Pete College students. Would you talk to me, either of you, Melinda or Melvin, talk to me a little bit about that? I was very surprised that you did not include it as a logistic partner. And I want to know who are your contacts there, and how is this all evolving, I guess, is really what I'm asking about.
Oh, well, that unfortunately, I guess that was a oversight that they were not included because they are a partner with us, and we do have an existing MOU in place with St. Petersburg College. We have some food pantries on about 5 of their campus locations and have had them for about a year. And recently, with school being out, they haven't had a need for food for that period of time. And they did a needs assessment among their students and found out that, most of the students who received additional money, I guess there was stimulus for education funds, a lot of that actually ended up having to go to food because they were having a major issue with food insecurity. And so that's when they asked us if we could apply for additional funds to provide specific food boxes for the different locations twice a month at each campus location.
So how long has the MOU been in existence?
Well, we had a MOU specifically for our Express Center that we operate on their Midtown campus, and that had been initiated about a year ago, but we've had the pantries on their campuses for longer than that. We just finally initiated an MOU this past summer.
I see. So, but it does seem like the springtime of this year would be the time that the students would need the assistance the most, because probably many of them were out of jobs, and whether they were part-time or full-time. So, but you weren't providing food during that time? I guess I'm not
Just
clear about.
the campuses were closed.
Yes.
So the pantries on the campuses weren't able to be accessed.
I see. So they're physically inside the campus.
Correct.
And there was no way to get the food out to the students. Okay. Seems like a missed opportunity. And that's too bad. Okay. Any other questions of either Melinda or Melvin?
I had just a technology question. I see that you're getting, several iPads and laptops out. And are you using them outside, and it didn't look to me like you were upgrading the internet. Did you check to make sure that they would all work and you didn't need anything additionally? Because I know sometimes when you add a lot of technology at once.
Right. Yes. We just recently switched over to fiber internet. And so we've been told that it should be sufficient.
Okay, good.
Okay. Any other questions of either Melinda or Melvin?
So I do think, Sally, if we could, I do see a question there about just clarifying the number of clients served.
Yes.
Could we, as well as the relationship with Feeding Tampa Bay, could you help us better understand both of those? I think that might be important as well.
Mm-hmm.
Well, I can tell you with Feeding Tampa Bay, they are a partner agency with us. Basically, the relationship with them is that they are the contract holder for the USDA program, and we are their sub-distributor. So we distribute all of the USDA food throughout Pinellas County. And then we also partner with them for the retail grocery store pickups that we do on a regular basis. So that's our partnership with them. As far as the number served, I'm not really sure what the question is.
I think that was my comment, and I'll take ownership of it. I think it might have said in a narrative one number, and then in further down in like the measures, it said another number. So I don't know if it needs to have a full discussion on the panel, but I know the foundation on the back end is going in to assure all the measures are appropriate with the evaluator. So I guess that was just my way of making sure that there was a follow-up on that to make sure that was clarified. I think, and it really was in the narrative. I think it said one thing, and then when you broke it out, it was slightly off.
Thank you, Sarah. We will absolutely have a conversation with RCS and ensure that everything, that the numbers are all a match throughout the application. Thank you. That'll be important, especially for the evaluation pieces as well. So thank you for bringing that up.
Okay, thank you. Any other questions?
Sally, this is Barbara. I just want to note that happens sometimes more than you might anticipate, that as people are writing narrative, they say one question, and when they get to the measurement section, we try to catch that and address it on the front end. So we do watch for it.
Okay, thank you, Barbara. All right, any other questions? Is the committee ready to take action?
Yep.
Did I hear somebody making a motion? I haven't heard anyone yet.
No, I'll go ahead and move that we approve to RCS $108,641 as per our discussion this afternoon.
Thank you, Bill. Is there a second?
I'll second. Stacy.
Thank you. Thank you, Stacy. Is there any other discussion? Thank you very much. All
Sally,
in
before
favor,
we move on, just for clarity of the organization for RCS, we will ask that you will go back into your application, review it again to ensure that all of your numbers are aligned. with the committee's request.
Yes, absolutely. Thank you, Sharon. All in favor of the motion, please raise your hand. If there's anyone opposed, please do that the same. I raised my hand, but I was just using it as an example. Sorry. Okay. And the application has been approved. All right. Emery, we didn't get to say hello to you. Glad to see you here.
Yeah, thank you. Had a few technical issues.
Oh, okay. Well, that happens to all of us.
Yeah.
Okay. Directions for Living, the Lawrence Dimmitt, the 4th Mental Health First Aid and Training Initiative, and Behavioral Health. All right. So, comments, concerns? We have someone on the call with us, on a call with us.
We do. We have April Lott, who is the president and CEO of the organization.
Okay.
Sally, this is Barbara. I did have, from the evaluation perspective, one concern with their projection of a 100%, threshold for their outcome. I don't think that's realistic.
Okay. So you'll work with them on.
I mentioned it as a comment. I'd like someone to address it, just simply because nothing in this world is perfect, especially in this kind of environment. So I think, having a projected monthly success rate of 100% is probably just simply not smart.
Mm-hmm. Okay. So, April, hello there. I guess you're unmuted and you can answer the question if you heard Dr. Morrison Rodriguez.
Yes, thank you, Dr. Rodriguez, for your question. The reason we selected 100% is because, as you are aware, the application asked us to choose kind of one lofty goal, and that goal really is around the 3,000 people that we will train in mental health first aid, and then the services, of course, that will flow from that. My experience with training mental health first aid for the past several years is that there is 100% of the time, there is a knowledge increase and a confidence increase. There's a standard tool that is used by the National Council on Behavioral Health, which is the organization that has provided the evidence-based and research support to mental health first aid. So that's the reason we chose the 100%. I originally had put 85 to 90%. And then when we chose that one lofty goal, that's the reason it went to 100%. But I'm happy to, I hear you and I agree with you. Traditionally, I agree with you. So I'm happy to adjust that down if you think that would be wise.
Okay, and let me make one clarification to everybody who is listening. Our intention is not that your one goal be lofty. It's just that it be one goal and it be meaningful and rigorous and measurable. So I don't want people to read lofty as 100%.
Okay.
That's not the standard. The standard is that it's one solid, defensible, reliable measure that you can use on a monthly basis that in some way is a real statement about the benefit of your services, for whether it's training or direct services. So don't think lofty means 100%. That is not what it means.
I understand. Yeah. I understand. Again, I'll just be repeating myself, but the reason it was chosen as 100% is because, but I agree with you. We probably should go down to maybe 90.
That would be fine. And one other thing I mentioned about your application too, is this is a training initiative clearly, and you want to increase knowledge, and knowledge gain and behavior are not the same thing. That's one thing that I think needs to be made clear. People can understand something cognitively and intellectually and still not put it into practice. So one of the issues that I brought forward in your application, and I think I put this in a communication, is I think that one of the things that you ought to consider in some way is trying to look at, even if it's just intentionality, how some of your trainees are going to put what they have learned into practice. Their sense of how their practice may change as a result of what they've learned. Their professional relationships may change. For example, if you're doing peer-to-peer support building, as I think part of what your initiative was looking at, how are people, even though you won't be able to measure within this time frame whether they have put things into practice, I would be interested to know, one, if they intend to, and if they think that this additional learning has increased their capacity to actually put it into practice.
Absolutely. And that is all a part of our plan, right? Currently, right now, as we speak, that is all, if we get the support for this initiative moving forward, then we have a handful of other things that we will be tracking that, we didn't have the space to put into this application. I apologize for using the word lofty, but we needed to select one realistic goal measurement tool, but with a handful of the initiatives contained within this one initiative, we will be tracking any number of things. For example, once law enforcement at Largo or Clearwater becomes trained in mental health first aid, how likely then are they using that training to then connect people to the services that they need? That for example would be one measure that we will be looking at and tracking very, very closely.
Okay, thank you for that.
Okay, thank you, April. Yes, go ahead, Stacy.
For the mental health first aid training, I think it sounds amazing and very timely and so needed in our community. Would you, and this could be maybe something for later thought, be open to opening it up to people outside of first responders? I feel like almost anybody who deals with anybody in social services could probably use the training, and it could benefit the community a little bit more. So I don't know if you'd be open to expanding that to other.
Absolutely, Stacey. Absolutely. And I appreciate you asking that question, because apparently we were not clear in the application, but our intention is to train 3,000 individuals over the course of if we're approved, between then and December 30. And we will absolutely be actively working to get, what I'm going to call lay people, regular people, people from the faith community, people from grocery stores who, right now seem to be in the line of fire relative to, mask wearing and, just observing people's stressful behavior. But really getting everybody, right? We want to build this little mini army of mental health first aiders during this time, so that we are all recognizing signs and symptoms of emotional, crisis, mental health crises, and that we aren't afraid. And more importantly, that we aren't, reacting poorly, either A, ignoring it, or B, always calling law enforcement, which, as you know, is across the country is not resulting in good outcomes for people who are experiencing a mental health crisis. But to your question and to your point, we are absolutely open to that, and we'll be working very, very hard to include everybody that we can in mental health first aid training.
Awesome, thank you. Good luck with it.
Thank you, Stacy.
So I have a question about the budget, and could you just provide a little understanding on the couple of budget line items around purchase services, equipment, and the training?
Yes, I will do my absolute best, Emery. Tell me, do you have a specific question?
Well, just in the narrative, there was some information that wasn't there, and was just trying to get just like in those items what might be included, for just some examples, or just an understanding what might be included in those line items.
So in the well, let me pull it up. So like in IT, is that for an example?
Okay, so you had in the budget under purchase service, there was a line item and you had a number in there, and I'm just trying to understand what is included, what might be included in the purchase service line item number.
Yeah, so for example, we have in there to provide reliable wireless connectivity and allow clients to connect to telehealth sessions from our parking lot. So it is the technology that would allow our parking lot to become a hotspot. Is that the type of question that you have? Am I understanding?
Yeah.
Okay.
Yeah.
Yeah. And then, for example, internal network devices that allow computers, wireless network, and mobile devices to connect to DFL and telehealth services was another one. Staged power up and discrete power control, ability to power on servers in a controlled manner. The thing in the purchased services under IT in particular, we are, I'm going to use the word flip. We have flipped as of March 15th, right? We flipped a predominantly office-based, clinic-based mental health organization to a remote telehealth behavioral health organization, literally within probably 3 to 4 days. And we did that with bubble gum and, Scotch tape and duct tape. I mean, we really were not, from an infrastructure standpoint, we were not set up to do the rather aggressive flip that we did. With that said, I am extremely proud of my organization and all of the staff who were able to really just think it through and figure it out and move in that direction. But what we're asking for in this proposal is really to, the analogy that we use internally is that we initiated our emergency continuity of operations plan as if it were a hurricane, so to speak. And we stood up tarps and, whatever for roof. And now it's time to put the real roof on the organization, right? We're really trying to do what is necessary to be able to expand and continue to do what we need to do for our community from a behavioral health standpoint. So I can go through all of the things that are listed here for you. IT is not necessarily my forte in terms of the specific, servers and security mechanisms that we will be purchasing, data visualization tools, monitors, those kinds of things. That's what's included in this IT purchase services.
Okay, that's helpful. Appreciate it. Thank you.
Yeah, thank you so much, April, for clarifying. I did have a little more questions specific on 2 specific issues in the budget. One, the KPI software, and 2, the upgraded financial system. Yeah. While I'm very familiar with the great work that your organization does, and I understand the need for it, I just want to make sure there's a COVID justification for those 2 technology standpoints that not that I don't think there is one, I just want to make sure that's clear in the application. So if there is any sort of justification that needs to get made, we have that.
Yeah. So the both of those, what I would say, I'll start with the second one, which was the Great Plains. Is that the one you're talking about? The funding? I mean, say it again. The one you said.
There's KPI. So there was one like an advanced data metric system, and then you also mentioned an advanced financial system for Avatar to link to Avatar. I think is what the narrative said.
So essentially, Sarah, I just go back to that. Right there, the Great Plains, that we have I would say a very robust billing operation and a billing system as a behavioral health care provider that works in that space. However, with that said, virtual services is a new billing. Virtual services is a very new and quite frankly complicated initiative. ACA, pretty much, the Agency for Healthcare Administration and all of the insurance companies have made allowances during this time to allow for telehealth and telebehavioral health services to be delivered. That has not always been true. Contrary to popular belief, that has simply not always been true. We are currently under, because of the executive order issued by Governor DeSantis, we are currently under a, just an exception expansion process. But we historically have not been set up to do 90% of our services being delivered and billed under a telehealth platform. So that's what that is to really get us to a place that of sustainability, that we're not letting, dollars run out the door, so to speak, that we don't, that invoices aren't being paid or that, that kind of thing.
Perfect. Thank you. Sorry, go ahead.
I'm sorry, Sarah. Did I answer that part of the question?
Yes, and I think you kind of captured the data in that too. I think the data goes along with the financials for you all when you're dealing with ACA. So I think you answered both in that.
Yeah, thank you for that. So, again, we, have operated in an environment where 200, mental health professionals were operating under two or three different roofs, if you will. And now, I have them in 4 different counties, right? The majority of them working from home in whatever county they live. And we're trying to make sure that, we absolutely have to make sure, back to, Dr. Rodriguez, we have to make sure that we are capturing our key performance indicators, that we are contractually doing everything that we say that we're doing, and that we have a way to track and measure it, despite that the service delivery is now being provided in a very, very different format.
April, what would be helpful is just the context that you just provided to update your budget narrative with that information. That would be helpful for committee around both issues, the upgrade of the financial system and the KPI software, just as eloquently as you just stated. If you could just add it to the budget narrative.
Okay.
And we can talk about that offline. I just want to capture that thought now. Sarah, would that meet and answer your questions about tying up the budget narrative and making it more clear?
Yes, I do have a couple more questions. If anyone else has questions, you can step in and I can come back at the end.
Go ahead, Sarah.
Please continue.
The staff self-care, I think, is great. I just want to know a little bit more of what are you going to provide? Like, is it lessons? Is it like water bottles? Just what kind of the plan is? Because I think that's so valuable. I know I deal with some of the staff at Directions often, and they're great. And I think they deserve the self-care items, but I would like to know more about that.
Yes, thank you, Sarah, for that question. And I so appreciate that you have just acknowledged the importance of self-care. So as you know, we're applying under a behavioral health, under your behavioral health priority. And the behavioral health of the staff who are attempting to meet the behavioral health needs of others is often an overlooked and undervalued asset, in my opinion. I've been trying to work on this for the past several years without a whole lot of success, I might add, and then COVID hit. And I have to tell you, we are stretching our mental health professionals. We are stretching them. They too have the same level of fears and uncertainties and concerns. They too are being impacted on a personal level by the spread of the coronavirus and those things. So we did in anticipation of this proposal, we did a survey to our staff, because we know that staff retention in particular is directly related to staff satisfaction, and staff satisfaction is almost directly related to, right, the organization caring for and people feeling cared for by their organization. And so we did a survey to say, we appreciate and value, right, that we're stretching you to the limit. A lot is being asked of you by our community. What kinds of things, one-time expenses, right? Because we're trying to operate within the confines of this budget. I mean, this opportunity, which is, a 3 to 4 month opportunity, 3 months now. And so the things that came back really were around sleep hygiene, meditation and relaxation, and movement, like fitness, and self-care type things. And so some of the things that we have included there are things like a Fitbit, the ability to track your steps, setting goals around those steps, a weighted blanket, things that have proven. All of the things, by the way, that we looked at and selected are things that are have proven to have a therapeutic benefit to one's own personal well-being and mental well-being. So a weighted blanket, sound machines, particular type of bedding, relaxation and meditation, headsets, and the ability to get it to do, relaxation and meditation, as you know, are two different things, but to do both either relaxation or meditation exercises through apps and those types of opportunities. I hope I'm answering your question, but really it was around, and the staff all participated in the survey, and I mean, they are just beyond grateful. By the way, we've noticed an improvement in staff satisfaction and morale simply because of the survey.
Exactly.
Because of the survey. We haven't even done it, but because of the survey, they are expressing incredible appreciation and gratitude that we cared to ask about their own mental health.
And that all sounds fantastic. I just want to assure, I know there's some restrictions on buying individual items. So my only thing is when and if we move to approve, to note that everything is allowable once it's bogged down to what specific purchases are going to be made. But I think the staff and how they respond is more than needs some self-care items. So I actually really appreciate you including that in your proposal.
Thank you, Sarah.
Okay, any other questions of April?
I do have a question around the 100 track phones and the 80 Samsung Galaxy tablets. How do you ensure? Now, I think those are for the client, right?
That is correct.
And so how do you ensure that should a client leave your program, that you get those items back, or is that not a concern?
Well, it is a mild concern. We chose the track phone, quite frankly, because of its low cost and its ongoing, if you will, value. The value of the track phone really expires, if you will, after if you no longer have service availability. So, but we nonetheless, it will be a loan program where, it's considered a directions for living property. It will be a loan program with the expectation that phone would be returned to us. Our staff work very closely with the clientele that we work with. So, my assumption is that it would be pretty easy to get it back, although we don't expect that we would get 100% of them back. But we have a few of these phones right now that we are using because, as you no doubt are aware, significant number of our clients who live below poverty level, who live in very struggling communities, they don't have cell phones often. They don't have minutes. The minutes that they do have are very limited, and or they don't have the ability to get to the internet. Wi-Fi is very difficult in some of these poorer communities. And I don't think our community as a whole is recognizing what it means to be poor in this community and what it means to be poor, and now with COVID on top of it. In any case, so we have some of these phones now. We purchased, we got a very small grant to purchase a handful of them, and they're working beautifully. We get them in the hands. When they no longer need them, they return the phone to us, and then we reissue the phone to someone else. They're very easy to clean and those kinds of things. So the tablets, though, we are purchasing the tablets for law enforcement. For law enforcement, after they would be done using them, if they still had a value, a depreciation, after depreciation, if they still had a value, those would be kept with directions for living. But the tablets are going to be used for the telehealth, the on-demand telehealth access 24 hours a day, 7 days a week to a clinician. or a psychiatrist.
Thank you.
Any other questions?
I
April
hate to
is
do
set.
it. Sorry, go
Yeah,
ahead, Sally.
Sarah.
I just wanted a little more information on the 911 crisis line. You just packed a lot of great stuff in here, so I have a few more questions. If you've worked out with the 911 that availability and what contact and communication you've had with them.
Yeah, so the reason we included that actually in this proposal is because 911, Regional 911 reached out to us, to Directions for Living at the, I guess at the suggestion of our Pinellas County Sheriff, and they were in a meeting with him. He suggested they reach out to us because they were finding that they had an increased and expanded need for mental health services for their 911 operators, predominantly because of COVID. That, you know, we often don't think about our 911 operators couldn't work from home. They didn't have the ability to do 6-foot distance, that, you know, that their structure, as you know, we all depend on for life or death type thing. And they were having a hard time. Their call volume has gone up. The types of calls that they're getting have changed, and their personal well-being and safety had to be set aside in order to meet the requirements of the job. So they reached out to us and asked us if we would be willing to do this for them, which is to provide on-demand telebehavioral health services that they could call whenever they had a tough call or a series of tough calls, if they could reach out. And so we set this up in partnership with them, kind of what I'm going to call as a pilot for the next, 3 months, with the hope that obviously that if they found it valuable and it extended beyond the 3 months, that we would find another way to continue that service if it was needed.
Thanks so much, April, for indulging me in all your questions and for all you do.
Thank you, Sarah.
Any other questions? April, this is Sally. I have a couple of questions, and I too appreciate what you do. I know it's very challenging times for your agency and knowing the needs that are out there. I'm wondering if you had a long list of logistic partner organizations, and I wondered how you're intending to work with them. Did you reach out to them and ask them what their needs were? Are you expecting that they're going to call you? What's the plan?
Let me get to that list real quick in my application so I can go through them. But the plan just in general is, in some cases we reached out to them. In other cases, we just have an ongoing, relationship. We would want to include them in some of these things. So for example, the community health centers of Pinellas, we work very closely with Pinellas, with the CHCs now with that team. Yeah, thank you for pulling that up. And so we would want to continue to work with them in particular around with the officers in particular, if they had a need to connect to a healthcare provider that we would be using. I'm noticing here that we don't even, oh yeah, we do, with the Department of Health. So many of you may know that the Department of Health, we are the Department of Health's behavioral health provider under contract. And so many of our people who live below poverty level in Pinellas County their health home is either the Department of Health or community health centers. So in that way, it would be that. The Hispanic Outreach Center, we work with them very, very closely. In fact, I have staff embedded in their organization with Jacqueline to serve their population, and often undocumented and that kind of thing. So we would be working with them, for example, to get their staff trained in mental health first aid, to, again, for really contact with services. So if we were to engage somebody, or a law enforcement officer in the expansion would engage somebody, that we could use the Hispanic Outreach Center.
Well, you don't need to go through one by one. I don't need for you to do that. I'm really talking sort of conceptually, because I called 4 of them 2 up county, 1 mid county, and 1 down county, who had not heard anything from you about this, the possibilities of working together on this grant. And maybe that's not in, your game plan. But it seems to me that one of the first groups that you'd reach out to is your partners. And so I'm a little surprised that didn't happen.
Well, maybe I misunderstood, Sally. I apologize for that. Maybe I misunderstood our, what we put here as our list. It wasn't necessarily to say that we would be partnering. We are partners, I'd be interested in the feedback that you received. We are currently partners with all of those, in my opinion, and with all of them, not necessarily specific to, I guess, to this particular proposal, although we would be reaching out to every one of them to say, like US St. Pete. Right now, St. Pete College, for example, we're working with them to try to get mental health first aid going. So maybe I misunderstood, and we shouldn't have included this list of community people that we consider to be our partners. If I shouldn't have included that, then I apologize.
Well, it probably is the case that you're working with them a lot, but I would certainly would imagine that you'd be reaching out to them, or maybe they'd be reaching out to you. You'd have communication about, okay, so COVID-19 is a problem, and are you seeing new clients, different kinds of clients, different issues that are related to behavioral health and so on. So that was what it seemed to me like it would be relevant to this grant. So another question, this isn't really a question, it's a commentary. I really liked your advisory board.
Yeah.
How often do they meet? You mentioned regularly in the grant, but regularly for some is once a year or whatever.
Quarterly. Our
Quarterly.
our CAB, our client advisory board meets quarterly. Although this last quarter they did not meet because of COVID. Unfortunately, they tend to meet in person. It's a robust group, and but the next meeting, if it can't happen in person, will happen virtually.
Mm-hmm. Good idea. I think, kind of the more the better right now. And most people are pretty accustomed. I mean, if you can't do Zoom, at least a teleconference call or something that allows people to have a forum, because it really is important. And I think your CAB sounded like a good mix of people, and I'm glad you have that involved in your organization. A lot of organizations don't do that as well as you all do. So thank you for that. Yeah. Okay, I think that's all the questions. A lot of the questions that were on my mind got answered in different ways. And this is a very large grant request. So I think that
Sally, there is another question in the chat.
Okay.
Regarding the training program. There is another question in the chat.
Okay,
regarding
good.
the training program. And so the committee member would like to know, how is the training program proposed here culturally appropriate? And I will leave an offer space for that committee member to chime in, specifically if there's something else additional they'd like to know.
Okay.
So the mental health first aid is a evidence-based research supported training program put out by National Council on Behavioral Health. They recently went through a rewrite of that program, which to include a lot more cultural competence and cultural sensitivity in the model or in the program. And so it is weaved throughout, has anybody here just been through mental health first aid? Anybody? Okay, well, I would like to get all of you through mental health first aid, but it really focuses on, someone experiencing a behavioral health, a mental health or substance abuse misuse crisis, and then kind of worsening symptoms, and then when it has become a crisis and when you call 911. And they go through what's called the ALGE method. The first step is always to assess for risk of suicide or self-harm. And so in each of the steps is the process of engaging the individual, which obviously depends a lot on relationship, but the training really speaks to cultural sensitivity and cultural competency, training on things like, in some communities, for example, admitting and or acknowledging mental health issues is frowned upon. We don't talk about it with others. We don't talk about it with strangers, and it's predominantly left to the church. When you have those issues, you go to the church. You don't go to a psychiatrist, for example, and that is talked about in great detail in the training. That it's not a one size fits all, and that we want to be sensitive to people's personal beliefs. Whether it's from a cultural or a religious standpoint. Things like, asking someone to look at you in the eye when looking at people in the eye can sometimes be respectful, and in other cultures and communities it can be very disrespectful. So that's just a few examples, but I think that you collectively would appreciate the curriculum and how sensitive I think it is to cultural needs and the cultural competency of who then becomes a mental health first aider.
Just a quick follow-up to that. So the individuals delivering that, or the staff, do you have a diverse staff that's involved with the delivery of that service or program? Okay.
Yes, absolutely. Thank you for that question, but absolutely. And that is a priority, and diversity is in my opinion, is an interesting, word. We are attempting to be diverse from a variety of vantage points or viewpoints, obviously, including having people with lived experience, people who have and live with and have recovered from and live with a mental illness, to obviously people of color, people of varying sexual orientations, people with varying forms of disabilities. We often have a plethora of women who want to do this work. We often have to work really hard to get men who want to do this work. So I just say all that to say yes to your question, Emery, and it is an ongoing focus point.
Okay, thank you.
April, I have one more question. It's Sally again. I have one more question related to the budget. The positions that you're including for counselors, are these new hires, or are we supplanting those you already have on board?
Well, it's not supplanting, and it's not really new. If we were to be moved forward with this application, our intention is to move people that are currently in position into these new positions, and then backfill those positions. Simply because we have such an aggressive timeline with December 30. We really don't have a lot of time to do the onboarding and the training and those kinds of things. So we've done a preliminary ask of our staff to see who might be interested in doing the work with 911 and doing the work with our law enforcement officers, as well as obviously helping with all the training. We have that list of people who are ready to go, so we could start those initiatives pretty quickly. But we would then, on our own dime, so to speak, backfill the positions that they would be vacating.
And they're master level positions, as you're proposing?
That is correct. Or master's prepared professionals, or even in some cases licensed, through the state of Florida.
Okay. Just a kind of a sidebar, if we're interested in enrolling in the mental health first aid, how do we do that?
Yes.
The committee.
Yes, I would love that, Sally. I think honestly, I think all of you would very much appreciate it. We will, it will be posted, it will be on our website, and we'll get information out everywhere. we will be sending that information to everybody that we know to get people enrolled. And I'll make sure that the Pinellas Community Foundation has access to that information, obviously, to see if any of you are interested.
Okay, thank you.
April, I have a question. I've gone through this. We have a group called Clergy and Clinician Together.
Yeah.
Where clergy in this community, we went through this to prepare clergy and senior pastors for, either bringing people from their congregations on board through the did that training. Is that much different than what you're doing, or is it pretty much the same because you're using that same curriculum?
Yeah, we're using that same curriculum, the mental health first aid. And so I would say it would be pretty much the same.
Okay, thank you.
And as many of you may know, once certified in the course as a mental health first aider, your certification is good for 3 years. And then 100% of mental health first aid training has been converted to virtual, just so you know that as well. So we can conduct all the trainings that we need to virtually. And it really, Zoom as the platform really has a lot of features that allows good participation and interaction. And
Okay. Any other questions? I heard a crash. Is anybody okay? Everyone okay?
Looks like we're all still here, so I think so.
I think so.
If no one fell off their chair, that would probably be just fine. Are we ready to take action, committee?
I would motion to approve per our discussions on the budget and the allowability of certain purchases, really services versus items, I think might be the issue on some things, but motion to approve.
I second.
So I guess for clarification, I'm asking, so you're not moving the full $1,339,385. You're saying that there's some massaging of numbers that need to be put in on the equipment side. Is that correct, Sarah?
No, I would move for the full amount. I think there are some items that are vague in the narrative, which rightfully so, I don't think decisions have been made. To just assure that those purchases, when made, are compliant with any grant requirements, which I know it's really just my attorney asterisk at the end of it, just to assure that it's compliant.
That's
but
great.
I move for the full amount.
Okay, thank you very much. And Ayako, the seconder, is okay with that?
Yes.
Okay. Any further discussion?
Madam Chair, I don't know how this is included in here, but I did ask the question on culturally appropriate trainings and the staffing. I don't know how you fit this in, but I like to see that be a line indicator in the evaluation, Dr. Rodriguez, so we can look at to see just how appropriate this training has been received in a diverse community. Is that acceptable?
I'm not sure it is as part of the evaluation on our end, Carl, because actually we're not going to be looking at that. But I think that the evidence that April provided about the cultural underpinning of this methodology, in my mind, shows that there's been attention to that. When she reports on who is involved in her training, you'll remember that we have requirements about zip code and some data like that. So we could assess, this is a little different from a service program in the community. It's a training program for professionals. But I think that the key issue there is that was raised is the cultural relevance of the training intervention itself. And at least I was satisfied with what she had to say about that. So
thank you very much.
Okay.
Thanks, Carl. You're always good about keeping us clear about the diversity issues, and thank you for reminding us of that, and reminding April too, because it is important to us. Are we ready to vote on the motion? All in favor, raise your hand. Anyone opposed? Okay, then I think that has come to conclusion. All right, moving along to the next item, which is Rhythm Changes, Inc., requesting $77,457 and 80% average score. So a little low on some sides, a little better on others. And I think we have Steve Turner on the line with us.
We do.
If we have questions.
And Sally, can I say something from the evaluation perspective on this one?
That's a good one.
Right,
Barbara.
it's a good one. I have a couple of comments. I was a little surprised, and I think this is an area where sometimes we define behavioral health far too narrowly. And this is a good example of what I think is a good behavioral health intervention for children. There is an enormous amount of literature on the value of both arts and musical arts, actually working with all age groups, but particularly children who may be stressed. I actually found a wonderful one-page article specifically about drumming, which I would be very happy to share with anybody who would like to see it. But there is a long, well-established evidence base for the arts as therapeutic interventions in behavioral health, so much so that, as you all know, you can actually get degrees in arts-based interventions for clinical interventions and behavioral health interventions. So I think the issue of the relevance of the approach, in my mind, is not a question in terms of its relevance as a mental health intervention, whether you support this particular initiative or not. The other thing is I wanted to say is I worked very closely with Steve on the evaluation of this. He has sort of a three-pronged approach, what he put in his application. And when we were trying to narrow down what was the one metric that he could present for this particular initiative, of the three, the one that seemed most likely to me in terms of being able to get your hands around it in the amount of time that this grant covers would be some evaluation of the impact of his drumming that he does virtually in the public schools with classes. And I know he'll tell you about his relationship with music teachers. But my thought was that the easiest thing to measure would probably be to take the class as the unit of analysis with about 20 kids in each class and have the music teacher, which is very common in educational settings, to have observations of how the students are interacting. So I said to Steve, well, what do you use as a lens? If you were going physically into a drumming class in the school, what would you use as a lens to know whether that drumming class was having an impact or not? So he talked about cognitive understanding of the material. He talked about how much students were able to follow directions, whether there was good interaction between the students who are drumming together as a class. And the article that I'm talking about is really brilliant at talking about the kind of cognitive skill set and the social skill sets which are needed when you're working as part of an orchestra or a group. So what we did was we actually came up with several questions that we would ask the teacher, the music teacher in the class, to observe the class and to rate the class along those dimensions. And then we have a scoring system for that. So that's his central measure, is what we're calling this teacher observation and rating scale, which we came up with for this. And he gave me the content and I worked with him on the design and the metrics. And it would be the scoring on that scale that he would use as his progress measure, which is written up in the application. So I believe it was that 75% of the teachers would rate that highly within a certain amount. I don't have the metric right in front of me in my mind right now, but I wanted the committee to know that we worked very hard on the evaluation component, and that if anybody has any question about this as an appropriate behavioral intervention, I have lots of stuff that you can read if you still need to be convinced.
Mm-hmm. That's good, Barbara. It's a very good setting and tells us with some assurance about this being a little different behavioral health type of requests that we've received, and yet still very valid in the...
Especially for children.
Mm-hmm. Right.
Yeah, that's helpful to me too, Barbara, because I didn't question, music as a behavioral health. It was more around the evaluation component of that I was just kind of questioning. And even I think there was there's a scale, a rating scale. And I think that my only question was, with the number of students and having teachers complete that rating scale on a monthly basis for that many students, how dependable have teachers proven to be in completing that? Yeah.
Right. Steve can speak to that because he's had relationships with teachers for a while. But that's, Emery, that's why I suggested that we make the class the unit of analysis rather than individuals.
Right.
Yeah. Don't want to have teachers, writing 20 evaluations every month times 5 classes. So but the reality is that the intervention is delivered to the class as an entity. It is a class intervention. So it seemed reasonable to have the teacher evaluate the dynamics and the student learn. The other thing that's very clear is these teachers know better than anybody else, sometimes even better than the parents, what the emotional struggles are of these children. They know their histories, they know how they have acted out in class, things that they may have talked to them about. So the teacher observation seems to me to be a very valid way of trying to look at the impact of what this intervention has on the children. Is the shy one reaching out more? Is the bully being more cooperative now that they're part of a group exercise and that kind of thing? And having known the personality dynamics in some of the situations of the children, to have the teacher do the observation seemed to be the most appropriate thing in terms of scope and also in terms of the time that the observations need to be made.
Great, thank you. That's very helpful. Appreciate it.
You're welcome.
Okay, any questions?
If I might, I'd like to suggest that Steve tell the committee a little bit about his history of doing this kind of thing in the schools and some of the preliminary conversations I know that he's already had with teachers. I just think it would be important for you to know that.
Thank you. And I was going to ask him to do that. Thanks, Barbara.
Steve, you can unmute yourself. Oh, did we have a question before
no, I just
Steve talks?
There were any other questions and he could do that as well. But if not, Steve on to talk about the relationship with teachers.
Well, first, thank you guys. Oh, hold on. I'm having an echo. Let me figure that out. There. Can you hear me now?
Yes.
Okay, sorry. There was a really bad echo. First, I wanted to say thank you guys for letting me be here and for being willing to take a look at this. I have been doing this work here in Pinellas County for 15 years now. I've visited almost all of the schools and after-school organizations here and, actually beyond into Hillsborough and beyond. I have a very close relationship with Pinellas County schools at the county level. The head of the arts department is Jean Reynolds, and I sent her the proposal for this grant before I actually submitted to y'all. And we have been talking about it. She's absolutely on board and has already disseminated this information to the music teachers. I already have 15 schools committed to both initiatives 1 and 2, and I have a committed school for initiative 3, which is Campbell Park Elementary School. So at the time of submission, I didn't have all the schools committed, so I didn't put the LPOs on, but now I do.
Mm-hmm.
Does that answer the question that you were looking for?
Yeah, in part, I think it might be good about your discussions with Barbara and the evaluation techniques. Are you good with that, using the class?
Absolutely. Absolutely. I can explain how that's going to work. We are going to be, all of the music teachers, and they're aware of this as well, they're going to be scheduling me by grade level, so that way we can have continuity of service. I'm going to see each of these 15 schools is going to pick at least 1 grade level, which is about 4 classes, sometimes 5. Each of those 5 classes we will schedule out because of their block scheduling between now and December 30th. And that way I will be entering their class. After each time they have me zoom in, they will be doing the survey on that individual class. As far as the video initiative, we're tracking numbers, but there's so many students that we're going to be able to reach that it seemed more feasible to do the testing on the second initiative.
Okay.
And Sally, one of the things I mentioned, and this is true of many of the proposals that are doing multi-layered initiatives, is for remembering that we're asking for one score, going back to that one metric, to think about, of the multiple things that they're doing, what is the one that could be most reasonably measured within that time frame and within the scope of the project. And so Steve and I looked at all of the things that he's doing. For example, I was thinking his intervention where he's going to be doing videos online that any of the schools could potentially, and I said to him, you know, that could result in thousands, if not millions of students. That's not anything that we want to measure within the scope of this particular application. So we did narrow it down to those classes where he personally is going to be going in as the instructor, as the easiest and most feasible thing to measure given the scope of this project.
Steve, would you mind commenting a little bit on the priority populations that you listed, which were communities of color, children, persons with disabilities, and low-income families? How are you assuring us that you are engaging them?
Well, I have been working in those populations for the last 15 years. I work with from the Arc of Tampa Bay to Park. In this scenario, we're already got commitments from Nina Harris and Paul B. Stevens, which is our special needs kids. We've got one autism school that wants to participate. As far as communities of color and the economically disadvantaged, most of the we focus priority programming to Title I schools, and most of the volunteer schools already are in South County. That's as far as I can get into the, specify the demographics on that specifically. We are offering some programming that I think will serve those populations specifically, though.
Good. And I assume Jean Reynolds is helping you open the doors at those schools to be sure that you're reaching the populations that we want you to reach. They
She's the one who sent every single music teacher in the county this grant proposal, and that she approved it, and we're already getting back responses. The county is absolutely on board.
Okay, good. Okay, other questions?
I'd also like to see some of the schools mid-county that may have the populations of communities of color, particularly those children that are coming from the Ridgecrest community, and some of the Tarpon with people of communities of color. I really love this work. I have two dear friends that are master's level music therapists. So, and one is in Dade County, and they're using them a lot in Dade County, in the schools, in the public schools. So, but I really like to see it also, not just South County, but in Mid-County as well as North County, to touch that population as well.
Absolutely. I can actually, I've got Walsingham is one of my schools, which is right around the corner from, I can actually, if you'd like, I can list the schools that I have, and I haven't even begun direct marketing where I can directly reach out to the Tarpon, both Tarpon Fundamental and Tarpon Elementary music school music teachers. I know one of them. So I have a really good relationship with lots of teachers here, music teachers in Pinellas County. I do music teacher training. So this has been an ongoing, my whole business is based on relationships. This has been ongoing, but thank you for that. I would love to reach into Tarpon. We're at Gulf Beaches. We're at Sanderlin is committed, Cypress Woods, Lealman Ave, Madeira Beach Fundamental, Fugate, Starkey, Dunedin, Kings Highway. There's some Middle County, Midtown Academy, Woodlawn Elementary, and Walsingham Elementary. And then we got Paul B. and Nina Harris. I don't know if you're familiar with all those schools, but.
Yes, I am.
So those are committed.
Yes.
I think one of the things too would be that when he is able to finish these videos, that could have very wide distribution, certainly
Absolutely.
beyond South County. So I think that's part of the marketing, is to get that out.
Awesome. Yes. And some of the private schools too.
Absolutely.
Like the academy there on 22nd Street, it's a middle school, and it's predominantly Academy of Color. It's a charter school, private school. So I'd like to see.
Did the Imagine School?
No, it's can't think of the name of it.
Okay.
It's right across the street from Sanderland.
Oh, I know. Okay.
Academy Prep.
Academy Prep.
I've done work with them in person before, so I will reach out. I mean, I haven't even done direct marketing yet. So thank you for those recommendations. And if you have more, especially for the private schools, I would love to have all and any. The video is available easily. It's time constraints that make me do the in-persons. That's what we're testing. But those are the two things.
Okay. Thank you.
Thank you.
Other questions or comments? Oh, we have Steve with us. Do I hear some drumming in the background?
You might have. That's a nervous tick.
Are we ready for a motion to approve the Rhythm Changes, Inc.?
Motion to approve $77,457 to Rhythm Changes Incorporated.
Okay, is there a second?
Second.
Marie, was that you that seconded the motion?
Yeah, that was me.
Okay,
Thank you.
Thank you. Okay, is there discussion?
Sally, just for the record, there are some questions regarding the budget narrative for Rhythm Changes, specifically around the executive director's compensation. And so that will be updated and more justification will be given for that, actually in the budget narrative.
Okay. And you'll work with them on that? I'm sorry, Cherie, I didn't hear that.
Yes, we'll be working with them on that.
Okay, great. All right, all in favor of the motion, raise your hand, please. Is there anyone opposed? It appears that the Rhythm Changes has been approved for social, emotional wellness through music, art, and connection. All right, I think we've covered them all, haven't we?
Yes.
Gosh, we did our job well today. But none of them are easy, are they? No one said this job was going to be easy. And that's why we're paying you the big bucks. Kidding, of course. Anyway, glad that you're willing to do all that you've done and will do in the future. Let's see, I don't have the agenda right in front of me, so I'm just going to guess that we're going to lateral.
We're at next steps.
Yeah, we're at next steps. So I will ask you to
Duggan, right?
Yeah, turn it over to Duggan, who's going to give you a little bit of update about the contracting process.
Okay,
a little bit more about how we determine contracts and payments and all that good stuff.
Yeah.
So just wanted to let everybody know a few different things, and then of course, like the rules from the federal government change every 7 minutes as well. So we got some new guidance today on some things. But once everything gets approved by you all, typically Cherie sends a listing to the county team. They conduct a final review of their own to make sure everything is good to go, and then give us the okay to enter into contracts. Sort of simultaneous to that, we're getting updates from the agencies as to anything the committee wanted updated, any of the budget narrative or anything like that cleaned up, so that when the county gives us the okay, everything is ready. Just to let everybody know, the contract is pretty extensive. It's about 15 pages. And then it has a bunch of attachments to it beyond that. So some of them are upwards of like 120 pages by the time they're done. Agencies sign via DocuSign. And then from there, depending on how they fell on our risk matrix, and we have taken information from federal guidance to create a risk matrix that helps inform us as to whether or not we're going to do any prepayment of the grant, or if it is strictly a reimbursement basis grant. So we've taken the federal guidance, boil that down to a very dispassionate rating form. And then we just answer questions, yes, no. And that gives us a low, medium, or a high risk grantee rating. And it doesn't mean anything about the grantee services. Really, it gets to, do they have an audit done? Are they regularly audited? Have they ever had a federal single audit? It gets to some of the questions that were asked today, corrective action type questions or findings in audits. And that helps us determine whether or not there's going to be any prepayment. And then from there, agencies still have to do weekly reporting. They have to, on a monthly basis, report to us their expenditures, and we will either reimburse them or we will issue another prepayment. So we take everything from there. All that information is available and will be available on the various parts of our website. So the community can see how organizations are performing, where they're assisting and serving people, how much of the funds they've expended, see their reimbursement packages, so they can see how everything was paid to an agency or what was paid. So we want to be very transparent about all of that as well. And we will work with agencies one-on-one. We know that for some of our small agencies that reimbursement is a challenge. And so in some cases, if we need to, we'll do every 2-week reimbursement. We don't take a long period of time to pay, like as if you were working on most federal grants or even with the state of Florida. If we're comfortable with the documentation that's been provided and they have filled out everything, then we'll go ahead and we'll pay them if it's in line with the budget and the expenditures are appropriately documented and backed up. And then the one thing that does happen also at the contracting time, we have 3 different webinars that we've put together for organizations. One of them is brief. It onboards them, lets them know about how to log in, the reports that are going to be required of you, how to put that all together on our website. Another one of them is a compliance and accountability webinar. That one's about 45 minutes, and it goes over the documents you're going to need to track, the information that you're going to have to put together for us, an introduction to spreadsheets. We have set it up so that you can actually use our materials and our spreadsheets to document all of your expenses and turn it in. They're all linked up. We've tried to make it as easy as possible. And then there's a third really brief, maybe 5-minute webinar on actually using that tool, that spreadsheet tool, to document your expenditures to turn into the foundation. So those are available to agencies once they've gotten the okay, and we move on to the work of contracting. So that's about it. And I just want to let everybody know, we also meet with representatives from the Pinellas County team every week, usually Wednesdays in advance of this meeting. Talk about issues, talk about expenses, talk about trends. So there's a good communication going back and forth with the county team as well. And we bring them ideas and issues from the community as well, in the event that the funding priorities need to be expanded, things that we're hearing from our grantee partners, all of that information we try to discuss on a weekly basis with the county team as well. So good communication going back and forth there too.
Thank you, Duggan. Are there any questions of Duggan? Duggan, I have one. And it's one that we've talked about before. There is continuing desire for, and still COVID-19 related, but issues related to some physical expansion of facilities or needs for refrigeration, being able to serve people better using mobile units, etc. That might be purchases better off than being rental.
Yes.
Any read on that for us?
So we had some discussion yesterday, actually, a little bit with the county about one proposal in particular, and trying to get a read on it before the agency actually completes an entire application and then finds out that it wouldn't be allowable. And so on one of those in particular, it'll be moving forward. There's capital expansion. And it is COVID related. It's an expansion of a facility so that they can appropriately social distance. It's an inpatient mental health organization. So it looks like that has at least on first review, it's been justified as COVID related, and then they'll have to continue to justify that through the proposal. But things like that look okay. And then others we look at on a case-by-case basis. If you remember, our very first week up, Feast was there, and they had some equipment expenditures, which was purchase of freezers and refrigerated refrigeration equipment. They did a good job justifying that for the period of the grant, it was actually more cost effective to go ahead and purchase than it was to lease that equipment. And so I would say for agencies that are out there that have questions, we'll take them on a case by case basis and try to get them answers as quickly as possible, so that we can figure out if we're going to move forward or not.
And the sooner the better that they contact us for sure, because
Yes.
it's building or finding building materials, which is a challenge in the marketplace now.
Yes, if it contains construction, the expenditures that we, as far as we know, and there's been no change to this with these particular CARES Act funds, they have to be expended by December 30th. So if there's building permitting that needs to go on, acquisition of materials, any of that's going to take some time, that all needs to be accounted for. Probably what we'll also need, at least in an initial estimate, from a contractor or construction company, is going to be needing to tell us what the estimated time to completion is, because we need to know if it reasonably can be completed within the deadline for the funding. And even if the usage is the usage is going to continue in the future, it's going to meet a need now and in the future, like the social distancing needs in an inpatient mental health facility. It's okay, but we just need that good COVID-19 justification, so that we can move it forward.
You may have covered this in an earlier meeting, but when is the last day we will meet as a team on this process?
I think it's going to depend on if there's an extension to any of the an extension or expansion to any of the funding. And because we continue to have at least 2 weeks out from now, I think we have applications that will need to be reviewed. We can see those and have them in the pipeline for 2 weeks out from now. And then we have several applicants, large applicants that we know will be having proposals come through that they just haven't submitted yet. And so I think we can anticipate meeting through at least October. And I think as we get closer to the end of October, we'll be looking at what the balance is there, plus sort of the amount of funding that remains to be allocated.
Excellent, thank you.
And
Carl, keep it on your calendar until mid-December.
Yeah.
Officially
December 17th.
Right. Right. And I suspect we will have questions that will be coming up along the way that we're just going to need to meet. So
okay. December 17th.
Yeah.
Okay.
I put it on your calendar for every week for you and
I think it's important that everyone notes that we are receiving applications on a rolling deadline. And so it's first come, first serve. So please, if you have an application draft, go ahead and move that forward and go ahead and click submit on that, because things at any point in time could change. But it is our intention to continue to spend until the funds have been expended on a rolling.
So Thanksgiving week, we'll meet on Wednesday. Did we already go over this?
No, we're
I
meeting
think
on
we'll
Thursday.
be having virtual Thanksgiving dinner together.
That would be
at noon. We'll meet 1 hour earlier.
You don't want an at-home potluck?
Carl is going to cook.
Yeah, there you go.
I will barbecue. Come on over.
Yeah, it's turkey for breakfast that day. No, we'll decide what day we're going to meet that week. Probably will be Wednesday. But Cherie makes a very good point, which is, I guess what you're saying, Cherie, is that it's very possible for a person, an organization, not a person, but an organization to submit an application that may not be as complete as we would like it, and you won't think it's ready, but at least they've got their foot in the door, so to speak. Is that correct?
Absolutely, because applications do not go to committee the day that they are submitted. There is absolutely reviews they have to go through so that when they come to committee, They are in a pretty much finalized form that you will have all the information so that you can robustly understand the application as presented, with tweaks perhaps along the way after committee review. And so sometimes and oftentimes that process takes about 2 weeks. So I'm suggesting for folks to go ahead, have conversations with me. Let's go and get the application submitted, and then we can tweak it along the way prior to it coming to committee, because of course we want to put forward to you all the best, most competitive application possible to move it to a yes, not a no.
Right.
Okay, that's great. That's really good to know, because we can pass that along to organizations that we might know would be excellent applicants.
Thank you. That'd be greatly appreciated.
Is there any other information that needs to come before this committee? Well, no one said running the Iditarod was going to be easy, so this one is not easy. Let's just keep running. I'm excited to see what's coming next, and so I hope you are too. Continue to do your homework as you've done. You clearly have read these, know what's going on, done whatever due diligence that you think is necessary to make decisions and recommendations, and I think we're in very good shape. Thank you very much. Thank you, staff, Barbara, Brian.
Quite welcome.
Everybody. Very good.
Does a great job. Appreciate it, Cherie.
Thank you.
And we even appreciate our technology expert, David. Thank you, David, for doing what you do.
Absolutely.
Absolutely.
Well done as always.
Duggan. Okay. Have a good rest of the day. You have 10 minutes to go and play before you have to go on to your next appointment.
Thanks